Hey guys, Adam Thomas, osteopath at Osteopath Central, here for the Sports and Spinal Rehab series. Talking about neck pain, headaches, whiplash, migraines as an umbrella area in which to deal with some neck and shoulder releases. Now, it's really important that you've had this diagnosed properly and you're aware of the stage of healing that you're in, because some exercises, particularly in whiplash and acute headaches and migraines, you know, sometimes what's absolutely the best thing for you in a few weeks' time is the worst thing for you right now. So if this is really new and you haven't had this diagnosed and you just found this on the website, please be really careful. You're best off coming in to see an osteopath, getting it diagnosed formally, getting your action plan and your prognosis set up with a management strategy that includes some of this, but knowing when to use this is just as important as doing it at all. So without overcomplicating it, if you've got the right advice, let's get stuck into it. Now, when people have neck pain, or they've had an injury that's created neck pain, or they've got neck pain and they're not sure why the neck pain exists, the most common rule of thumb that we see is a shortening of these muscles here at the side. They're tiny little fellas and they're called the Scalenes or Scalenes, and there's 3 of them each side, and their role is to side bend my head to the side, each side, and or if I stay middle and they both contract at the same time, they actually elevate the first 2 ribs and therefore drag up my rib cage up here. And that's all sort of, they're deep so you can't really see them, but as they contract and shorten, they actually elevate. And when we're stressed, overwhelmed, anxious, depressed, just in a state of always going in this Western world, particularly if we're overwhelmed, we have that shortening breath, which we talked about in the breath series. Most likely, neck pain, you need to deal with your breath. There's a video on that, go chase that down. Once you've completed the breath series, you'll move straight into this neck stretching series, more often than not, unless advised otherwise. These Scalenes, there's 3 of them, and the first one we're going to do is plant a hand on your skin, hold the skin down on this, for me it's my left hand side, and by keeping my chin in and take my head to the side and ever so slightly backwards. And the purpose of holding this down is to increase that stretch and keep my shoulder blades back and down by squeezing them back and down. It's often helpful to close your eyes and breathe into these stretches, and as you breathe deeper and deeper, you get a deeper and deeper release. Now, you would hold them, my usual advice is to hold them for 8 long slow breaths, as opposed to counting to 30 in your head or a minute and a half in your head. Just count 8 long slow breaths, because it's often the breathing that will help release them as well. That's the lateral muscles. We now need to deal with some side benders again, but also the shoulder shruggers. If you're one of those people who constantly work with the shoulders around their ears, or drive a car with the shoulder around their ear, or heaven forbid you're on a phone, pinch between your shoulder and your ear, those muscles often tighten up way too quickly. You can sit on that same side hand, or you can tuck it behind your back. Either way, we need to get rid of this hand and make sure my shoulder is back and down. We're then going to take my chin around and down towards nipple, hip, or knee, depending on what quiet direction gets you. Now, experiment with that, because for me that is a better stretch than that. And we're working with any of the fibers of what's known as the Levator scapula, the muscle that elevates the scapula, the shoulder blade, and or the upper fibers here, the trapezius. Now, both those muscles are similar stretch makeup, okay? From there, or there, they're only little shifts, but can often be a completely different muscle you're stretching. So experiment and experience all of them. And when you find that one that's the most tight, you can often either reproduce your own headache, which is nice to sit into, relax and breathe into, and again, holding those stretches for 8 long, slow breaths. Naturally, you do it each side. Now, this arm isn't pulling. You can overdo this, yeah? You can strain those muscles by pulling too hard. This hand is relaxed, and it's just an extra little bit of weight in order to stretch those fibers out from the tip of my shoulder up into the base of my skull. So we've done step 1 was the breathing. Step 2 was the scalene stretches either side. Step 3, which we've just done, is these muscles at the back. Step 4 regardless of your dental history or whether you think your jaw's involved or not, 9 times out of 10, your jaw is either compensating for or responding to an aberrant usage pattern of your neck or some increased muscle tension or a forward carriage of your head. Now, when your jaw starts to swing properly, it's amazing. It'll go for years and years and years and years without even letting you know that it's sore. So it's important to get to it straight away. That'll be an add-on video, the jaw series. All the best.